One thing that I want to solve is health system fear. And when I talk about fear, there's always going to be a fear of partnering with innovative companies, especially when we're in the business of delivering care, just like they are. And there's often this misconception that, if we're getting referred a patient, that we're going to steal that patient. And the reality of most health systems, neurology groups, is they just have way more patient demand than supply that they can staff up to. Even if they were to go and hire a virtualist, so a additional virtual provider, the cost of hiring, of paying a full-time salary, of onboarding that doctor, and then dynamically keeping up that supply with the ever-growing demand is far higher cost than partnering with a solution like ours.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Elizabeth Burstein, who is the CEO and co-founder of Neura Health. Elizabeth, thank you so much for being here today. I'm super excited to have this chat, and welcome to the podcast.
Thank you so much for having me. Happy to be here.
For sure. Why don't we start off with the same way that we start all of these conversations, which is just you telling a little bit more to the listener about yourself, about Neura Health, who you guys are, who you help, and any other context you want to share about the company.
Yeah, so Neura Health, we are a online neurology clinic. We're nationwide, and we were formed because the average wait to see a neurologist in the US is 4 to 6 months. I started this company in the pandemic along with my co-founder, Samir Madan. We both come from computer engineering backgrounds. My career background is in digital health product. So before starting Neura, I was head of product at Maven Clinic, the largest telehealth in the women's health space. And before that, I was director of product at ZocDoc, helping to build a more consumer-friendly front door for patients scheduling appointments. And we are a Series A startup with a core mission to assure access and quality of care for neurologic disease.
Amazing. Thank you so much for sharing that. And tell me a little bit more about how that engagement happens with a lot of the patients. I'm not sure if you guys refer to them as patients or as clients, members. There's many different ways, so we can dive into that as well. But tell me a little bit more about how that happens, how they usually find out about you, and then what that process of helping them what actually looks like.
Yeah, so fun fact, one of the top 5 most commonly searched phrases on Google is neurologist near me. And that stems from a massive shortage we have of neurologists. The way that most patients find us is they're looking for access to our specialty type. And most likely they're looking for a local, small clinic or hospital, just because the concept of teleneurology is very new. And so the average consumer typically makes an assumption that neurology must be done in person.
Mm-hmm.
What we did early on was we spoke to many different advisors and clinic owners of brick and mortar neurology clinics. And one of our core insights was most of these visits that, the patient was waiting for the appointment, getting in their car, sitting in the waiting room, finally getting there. Most of those visits just end up being talking, to the doctor, going through a detailed history. Not many of appointments in the conditions we treat would require any kind of physical exam or physical procedure. So we kind of debunked this myth that neurology is something that has to be done in person. And, saw this wave of companies, mental health is an obvious great use case for telehealth, primary care as well for, some of the simpler use cases like access to birth control, things like that. I think neurology was not necessarily the most intuitive because when people hear neurology, maybe they jump to conditions like Parkinson's or MS or really serious neuromuscular disorders. The reality of neurology is there's these massive disease categories like migraine, headache, pain, epilepsy, concussion, amounts to over 143 million people that have one of our target conditions at some point in their life. And most of those disease journeys, you can make a huge dent with digital-only treatment. Not just telehealth visits, but also engaging with patients through text messaging, delivering digital content, and really just being there to be the quarterback for their care journey.
Yeah. And I would actually assume, and correct me if I'm wrong here, but I would assume that even their engagement goes way up, right? Because they don't have to worry about, hey, when is that schedule that I have to go to the doctor and then drive that way and go through traffic. But more so, hey, we have that instant connection that you can have through the virtual services that makes everything so much more frictionless. It creates that seamless transition for them to have those conversations. And I actually love to hear this from you as well. That usual wait is around 4 to 6 months. What does that look like for you guys?
Yeah, so our wait is less than a week. That's actually a guarantee that we make on the platform, is that from the moment you come in and make an account, you will have a visit with your clinician within less than a week. Behind the scenes, there's a lot going on to meet that SLA. So, we think of supply demand forecasting very similar to companies like, Uber, where they're constantly growing, the volume of riders and have to make sure they have enough drivers. So similarly on our platform, right, it's the physicians and the patients, and we have a very sophisticated process wherein we're looking across now 33 states, different levels of providers. So we have MDs, we have physician assistants, we have nurse practitioners, and then we have 8 different subspecialties like, headache versus epilepsy, et cetera. So we have to look across all those different combinations and make sure that we're staffed up appropriately so that, if you're a concussion patient coming to us from Colorado, that we have that physician availability for you in the next.
Awesome. That's really, really cool. And just for the final clarification here as well, do they have to go through a physician to then get your guys' services, or is that not the case at all? Because I think in the usual scenario is like, hey, talk to the physician will then send you to the specialist. But to me, it doesn't really sound that way to you guys. Is that correct?
They do have to go through a clinician. Yeah.
Okay.
So we directly employ clinicians.
Oh,
And,
okay. So that.
yeah, so we are both a technology platform, but we also actually operate our own clinic. So the clinic is called On Demand Neurology, and those clinicians are either W-2 or 1099 directly employed by us.
Oh, awesome. So they don't have to go through their own personal practitioners. They can just use your guys. That's what makes it so fast and so seamless. That's really, really cool. Thank you so much for sharing that. And I'd love to hear from you as this final piece here, and then shifting the conversation into Neura itself. Tell me some of the patterns that you've noticed. A lot of the things that the clients that you guys serve and call it the main pillars of value that they feel they receive once having the engagement with you, because I would assume that you notice those things like, hey, these are the things that we're doing for them that is just really skyrocketing their results, their health, the speed of health, speed to help, and then the speed to back to health as well, and the help that they get. So tell me a little bit more about those patterns you see.
Yeah, so we have really unprecedented clinical outcomes. So for each condition, we focus on specific metrics. I'll take headache and migraine as an example because it's a very common condition within neurology.
Sure.
So for that disease vertical, we're looking at how much faster on Neura does someone have a significant reduction in the frequency of headaches, in the severity of their headaches. And even how are we reducing the volume of ER and urgent care visits? Because the reality is when someone doesn't have access to the right type of specialist, typically they use urgent care as a backfall, or even they go to their primary care doctor who, is doing their best to help, but it just isn't a headache specialist. So often, is not aware of all the nuances of the medications and, what is right for this individual in terms of acute medication, dosage, time of day, and then also preventative medications in addition to habit change. So for us, it's really the underpinning differentiator is this fast access to a correct subspecialist, right? Someone who knows this condition deeply, and that knowledge, like democratizing access to that knowledge, is really, what allows us to have differentiated clinical outcomes. The care itself that we're, doing on the platform is evidence-backed. It's not, it's not like a new care model. It's not a new therapeutic. It's not a new device.
Yeah.
But by virtue of creating this connectivity to the right type of subspecialist, that's really what drives our superior clinical outcomes. And some of this stems from, there are people in rural health medical care deserts where they just don't have access to this specialist. They've never even met a neurologist in their life, and they clearly have a neurological issue. And so, every week we see these testimonials that are like, oh my gosh, I've been waiting for this my whole life. I've been misunderstood. I've been misdiagnosed.
Mm,
My doctor hasn't taken my symptoms seriously. I
mm,
don't feel seen. And finally, with Neura Health, I'm feeling that.
yeah.
And a big part of that is getting them in front of this specialist that's unfortunately very difficult to access.
No, that's awesome though. Thank you for sharing that. I always love hearing the real stories of the real people having real impact in their lives. So thank you for sharing those too. And it's very refreshing to hear that it's not, hey, just this is the templated thing that is going to work for you and everyone else. Like, no, no, no. Everyone has their own different conditions. So awesome to hear that you guys are very well versed on that side of things as well. And then now I love to shift the conversation, as I said, into Neura itself, into the company and what you guys are going through. One of the big points that I love to highlight in this podcast is that as much as from the outside, many businesses can sound phenomenal. So on the inside, it's not always sunshines and rainbows, as we know, as the leaders leading companies. So I'd love to hear from you, maybe some of the challenges when it comes to the growth of the company and how you envision that coming. If it's from maybe an awareness side of things that people aren't really familiar, that this is something that exists out there for them, or even, hey, now they found out about it, but they're not really convinced that it's better than the an in-person. So tell me about some of those challenges, and if those that I mentioned are them, hey, perfect, great. Tell me more about those. But if it's something else, I'd love to hear that as well.
Yeah. So on the consumer side, right, consumer psychology, for sure, there is a challenge to be one of the first players in this specialty category for telehealth. If we were a mental health company, that challenge is much more solved, right? Because there have been hundreds of telepsychiatry, telepsychology companies there before us to kind of chart that course and help the average consumer understand. Of course, it's better to have access to a mental health professional, whether it's in person or from home, than to have none at all.
Mhm,
Case of teleneurology, there are, of course, many consumers that immediately get it. They're like, oh my gosh, I need access to a specialist. This is amazing. And then there are, quite a few people, some of them are elderly, some of them are just less digitally savvy, digitally comfortable,
mhm,
who initially are very doubtful. And so we have a whole team called the Membership Advisor Team, and they will offer free consultations about the Neura Health membership to primarily just get patients comfortable and help them understand, whether or not their condition and their use case is appropriate for telehealth. Some of them will not be, and that's
mhm,
fine. And
mhm,
we're very specific around, what are the conditions that we're not going to treat here. So,
mhm,
for example, we do not treat Parkinson's on the platform. We do not think that's appropriate given, where we are today. However, if it's someone who has essential tremor, that is a condition that we treat on the platform. And it is a challenge, but it's not an insurmountable challenge. It's really one where we're leveraging education, kind of white glove hand holding to help
mhm.
educate the average consumer on why this can be a really great option for them.
Yeah. Awesome. Very cool. And I wanted to actually circle back to something you mentioned in the beginning, which was kind of surprising to me. You mentioned that it's in the top 5 searches within Google, neurologist near me. And that's I don't know what I expected you to say, but that wasn't one of the things that I expected you to say, right? So it sounds like that's where a lot of traffic comes through for people learning from there. But then that's also in the assumption that they're just looking for neurologists in general. They don't assume that's going to be virtual, and then they find out about you and go through that process. Is that a major part of how they're finding out about you? Is it a lot of word of mouth coming through? Tell me a little bit more about that dynamic, because I just found that so interesting when you mentioned it.
Yeah, yeah. So Google search is a huge part of how, consumers find healthcare these days. Many consumers will also figure out which provider to go to in their insurance portal. So that's another discovery mechanism is we are now in network with over 50 health plans. Some of
Mhm.
those plans will have like a virtual center of excellence or just list us, in their directory as another great option for neurology.
Yes.
And 60% of zip codes in the US actually have no neurologists. And that's where us, having a presence there really makes a
Mhm.
big difference from a discoverability perspective.
Mhm.
We also partner with large health systems, and health systems will typically share their wait list with us, or they will refer patients to us when they're really
Mhm.
backed up. So most neurology departments in the country have a supply issue. So they don't have enough supply of specialists to meet the demand. And so some health systems, right now we're talking in August, they're booked out until like February, March, or beyond. So typically what we'll do in our sales process is we will call and just understand if I'm a patient and I'm trying to get an appointment as someone who's suffering from, migraine, epilepsy, what have you, when is the next appointment? And we're very often, seeing like 6-month waits, 8-month waits. And that's where we know we can make a big difference is helping them see those patients sooner. It'll drive up, patient happiness, retention. There's also a revenue component where they can grow their business by working with us.
Yeah, no, that's really, really cool. And then in a way, I think that ties into perfectly with everything that we talked about. If there is that white glove service, if there is that fast help, that instant value, so to say, that you can give to the customers, they likely know someone that probably has similar issues or maybe different issues that they have on their own. Like, hey, we have this amazing thing that we just went through with Neura Health. You should definitely try that out. And then now word of mouth spreads from there on as well.
Yeah.
Amazing. Very, very cool. I'd love to ask a question for you, Elizabeth, that I've asked almost everyone on the podcast, which actually ties into that challenge framework, but in a little bit of a different way. Let's say you had a magic wand and you could just wave this amazing wand and just solve one challenge in the company, obstacle, hurdle. I don't know what you like to call it. Call it whatever you want. To then reach all the client acquisition goals, all the revenue goals, all the growth goals that you have for the organization. I think so many times as business leaders, we are focused on a million different priorities at once. But right now, just one of those things to get all the growth goals, revenue goals, whatever they are that you want to achieve. What's the one thing you want to solve?
The one thing that I want to solve is health system fear. And when I talk about fear, there's always going to be a fear of, partnering with innovative companies, especially when we're in the business of delivering care, just like they are. And there's often this misconception that, if we're getting referred a patient, that we're going to steal that patient. And the reality of most health systems neurology groups is they just have way more patient demand than supply that they can staff up to. Even if they were to go and hire a virtualist, so a additional virtual provider, the cost of hiring, of paying a full-time salary, of onboarding that doctor, and then dynamically keeping up that supply with the ever-growing demand is far higher cost than partnering with a solution like ours. So yeah, if I were to wave a magic wand, it would be to, dispel that sort of fear of disruption and allow for the priority to really be around facilitating access, delivering a great patient experience. Particularly because when you go to the reviews of, these neurology groups, often patients are not complaining about the care. They're complaining about the access to care, particularly the inaccessibility of the care.
Interesting. Yeah, it sounds like it's more so like, hey, how can we educate them on the value that we provide as this partnership, as opposed to we're coming in to steal everything that you guys have. Just that reframing for them. Awesome. Very, very cool. And then one final question that I have for you here, Liz. It's actually not a question from me. It's a question from our last guest to you, and they had no idea who you were. So here's the question. You ready for it?
Fun.
All right. What would today's version of you tell your younger self on the first day of your career?
It's a great question. I would tell myself to really build innovation dynamically around the latest market trends and constantly be evolving that build thesis. And it's interesting because even in my own career, with everything that's happening with AI, before this AI wave, there's been so much innovation in, SaaS tooling, the way that companies are building really efficiently. And so I think that keeping a pulse on the latest technology is really, whether it's, in your own startup or even before when I was leading product for larger companies, constantly staying up to date on the latest technology is so vital.
I love that a lot. You'd be surprised the amount of people and conversations that I've had that all they know is that, hey, ChatGPT exists and that's about it. Like nothing else, right? So I completely agree with you. I like the term that you use, just keeping a pulse on it. I love that a lot. That being said, Liz, thank you so much for your time. This has been such an incredible conversation. Where should people go if they want to learn a little bit more about you? And of course, also a little bit more about Neura Health.
Yeah, so our site is www.neurahealth.co, not .com, .co. We have a blog that, we're regularly sharing some of the patient testimonials, some of our provider bios of the ever-growing neurology team. And that's also where patients can go to sign up if they need a neurologist.
Amazing. I will leave as many links as I can down below here if you want to check those out. And if you enjoyed listening to this conversation, you want to hear more conversations like this, please also hit the subscribe button and I will see you on the next episode. Liz, thanks again for your time.
Thank you.